Hello, everyone. Good afternoon. We are here today to talk about mental health. Represented here is different mental health champions with basic needs, basic rights. Basic Needs, Basic Rights Kenya is a non-for-profit organization that creates awareness on mental health in order to eradicate stigma and discrimination. And we do this as mental health champions or people with lived experiences of mental health conditions. And this being the Mental Health Month, Basic Needs, Basic Rights has been participating in a campaign called the 5-Week Challenge, which we encourage you to participate in by doing the Quality Rights Program. The Quality Rights Program is a program or initiative introduced by WHO in partnership with Ministry of Health that aims to educate us on how we need to treat people with psychosocial, cognitive, and developmental disabilities, as well as people with mental health conditions. And it's a very short program. You can do it online using the link from our social media platforms. And we will have different champions who I will ask to introduce themselves, and we'll be talking about one of those aspects in the Quality Rights Program. So we can start the introductions. I will be mentioning who will come next. So I am Immaculate Wanjiko Karanja, a digital marketing consultant and a social media strategist, and a mental health champion with Basic Needs, Basic Rights. We can go to Masha.
Hi, everybody. My name is Masha Mwangi. I'm a HR consultant, and I am a mental health champion with lived experience. Yes.
Thank you and welcome, Masha. We can go to Fidil.
Okay, hi everyone. My name is Fides Wanjiru. I am a pharmacist and a mental health champion with BNBR. Yes, thank you.
Thank you and welcome. We can go to Tabitha.
Hi everyone. My name is Tabitha Kabura. I'm a travel consultant and also a mental health champion with Basic Needs, Basic Rights Kenya. Thank you.
Welcome. You can finish with Brian.
Hello everyone, my name is Brian Emmanuel. I'm a disability rights advocate, and also I do a lot of social media marketing. And I'm happy to do marketing. And I'm happy to do
Thank you and welcome, Brian. We are so glad to have each of us here represented today. We can mute ourselves and unmute only when one is speaking. So today's discussion is going to revolve around Article 15 and 16 of the CRPD, that's the Convention on the Rights of People with Disabilities. And the theme there is that everyone should have freedom from torture, cruel treatment, inhuman treatment, abuse, violence, coercion. But unfortunately, we know that this has not been the case for people with psychosocial disabilities, people with mental health conditions, and especially in our African settings, because of stigma, because of misconceptions and myths, especially related to spirituality. So most of the time we have seen that there has been either chaining of people with psychosocial disabilities, chaining of people with mental health conditions, isolating them, and people live in a dark room all their lives because their families don't want to expose them to the public. There has been coercion, there has been violence, even physical violence, and it is very, very wrong. Apart from that, there has been maybe forceful medication or sedation, sterilization, not having a say when it comes to things like abortions or birth control or even pregnancies, and abuse. That's how a lot of sexual abuse happens. And so that is what we want to speak against today, because that is very wrong. It's very wrong and it should not happen to anyone. Apart from that, there has also been trying to use finances to control a person, financial manipulation, trying to control a person's resources so that they, to force them to do something. So we'll be talking about any kind of ill treatment, violence, coercion, or torture that we have gone through. And as we acknowledge in the UNCRPD, it is wrong. No one should go through all this. Remember, one of the very important themes or principles is that everyone deserves to be treated with respect and dignity, regardless of who they are, whether they have a condition or not. So I'm going to give an opportunity to the different champions represented here, and we can share our experiences if we have experienced any of all these things that you're talking about today. We can start with Brian.
Thank you so much, Immaculate. And personally, the only kind of experience I've had before was being over medicated, and this happened when I had a relapse back in 2016, around 2016. So what happened, I had to be taken to hospital, but each time I came to, they walikuwa wananidunga, they would add another jab, which they never gave me the reason, because I wish they gave me a reason why they did that, but I was never given an explanation as to why they had to repeatedly jab me each time I came to. And this led to some complications, like some minor complications later on, that involved the nerves on my right side. So I couldn't write and I couldn't walk properly for a week. For a couple of days, I wasn't able to do so. And that, to me, I think there's a degree of lack of is it responsibility, as in I don't think they did the right thing. What they did wasn't the right thing. They should have asked me if I'm okay with it, or even called for a guardian or next of kin, which never happened in the first place. So that's my personal experience.
Thank you so much, Brian, for sharing that, and even for going a step further and sharing what they would have rather done. Instead, let them explain what is happening, why are they doing that, or let them engage a person who is close to you and will understand you better. So thank you so much for sharing that. We can go to Masha.
So my experience, I will share two of them. Two of the experiences which I feel like my rights were violated. Having read the World Health Organization human rights, I knew I was violated, but I didn't know how to do it, because the people who violated my rights are the people that I expected to protect me. So on the first one is the caregivers. My caregivers, they used to lock me in the house when I was experiencing panic attacks. So they would go on their errands, they would lock me from the outside. And the more they would do that, the more I would get worse, because to them, they were trying to protect me, I understand. But to me, when they locked me inside, my panic attacks will go worse, and I would convulse, I would get so bad, such that, like, at one point when they came back and I was in a bad shape, I could not even talk to them. I was just hallucinating. So that's one of the worst thing that happened to me through my caregivers. And the other one is when I went to the hospital, because the kind of medication
It's like we are losing you, Masha. I don't know if you can hear us, or is it on my side?
They told me that I was giving me was okay at that moment, but not good. And they gave me, can you hear me? Can you
Yes,
hear me?
you're now back. You're now back.
Yeah, so I was talking about the hospital on me. So I got a job also, and on going home after 2 days, I got a nervous breakdown and palsies. And for 3 months, I could not talk, I could not walk. I had to relearn from that. And it after going to another facility that they told me is the kind of medication I was receiving, the side effects were too much. So for me, I felt like my rights were violated. And even since then, I changed my way of thinking. And even when I went to a facility, I could not accept to just get prescribed until they explained to me what this prescription is all about, the side effects and all this, because it would have cost me my life. Thank you.
Thank you so much, Masha, for sharing that. And just as you have said, it's very important that we learn the cause, because it's only after we now know how our rights have overly and consistently been violated that we can speak against it. So thank you so much for sharing that. You can go to Fide.
Okay, mine per se, I can't really say I was violated exactly, but mine was the aspect where I would tell people what I was going through and nobody would believe me. People would just think that I was pretending and they would, brush me off. So initially when I got sick, I actually didn't understand that I had a mental health illness. So I would just lock myself in my room, cry, you know tell myself that everything is going to be all right, but as in the situation was not improving at all. So I remember once going home, back to my parents. So my caregivers are my parents, they are my family members. So I remember telling them what I was going through, what I was experiencing, but nobody seemed to believe me. They were just like, you know what, it's going to come to an end, so don't feel bad about it. Anybody gets stressed up and like that. So I remember one time going to the hospital, and they were like, she's been pretending, she's doing this, she's not behaving appropriately. We were even wondering, she's not sleeping at night. And I remember the hospital people looking at me and going like, you need to be. So in the hospital they actually discovered, that's when they actually was like, they were like, she has a mental health illness. But initially even my caregivers could not accept it, so it was something that was in denial. Then I remember they wanted to give me a jab. So they wanted to inject me with a drug, but somehow I just managed to escape, because I pretended that I had to pick a phone call, and then I just disappeared and went to a friend's house where I stayed for a month. And I remember during that 1 month they kept on calling, and I would be like, I'm coming home, but stop pretending, stop pretending that there's something wrong with you. You're just fine, you're just okay, you know so mine wasn't per se as violent, but it was really a traumatizing situation during that time. Yes.
Thank you so much for sharing that. And yes, even that is ill treatment. That is still ill treatment, and it should not happen to anyone. We can go to Tabitha.
Thank you, Emma. So I also had an experience with over medication, whereby I used to be given so many drugs. I used to be given so many injections. I understand for what purposes they were for. And this also affected my nerve system. I couldn't do any activity. In fact, I was bedridden, and after 2 weeks, I had to be trained on even walking. In fact, even walking was a problem. So that really took me back. Another thing that I can say is experience started back then in Germany when I had gone for an exchange program, and the exchange program was me going to Germany and learning about the German culture and the German language. But once I finished the process and went to Germany, upon reaching, I was not going for exchange program, but I went as a house help. So that one really violated my right, because in my head I knew I was mentally prepared that I'm going as an exchange student, but not as a mental health, not as a house help, sorry. And I also went through torture because I think those people they were racist, and the reason why they took me is because they knew that I was Black. That is my thinking, because they used to abuse me sexually. In fact, the father of that house used to abuse me sexually, and he used to, I think that is the one which is called coercion. He used to tell me, if you're not sleeping with me, I'm going to make sure I cancel your visa and you're going back to Kenya. So that really affected me psychologically. But I never even at one point gave in to his sexual advances. And the mother used to cook food and not give me food. Like every day, he used to cook food and make sure that it's only them, the family and the children, that are eating. And in fact, during dinner or lunch, he used to tell me, go to I used to wait and maybe I go look if there are kuna leftovers, naenda nakula. In fact, the leftovers walikuwa wanazitupa kwa dustbin. So I used to eat from the dustbin, and that really affected me. And also, hiyo abuse ya kutukana, they used to tukana me, they used to tell me that I'm ugly, I'm stupid. Those people in Kenya, they starve. So they used to tell me bad things about myself, to a point that it really affected my self-esteem. And I used to hate myself. I didn't see as if I'm someone. At some point, I even wanted to commit suicide, but I thank God, but because someone saved me, and I was taken to a psychological hospital. So those are my experiences. Thank you.
Thank you so much for sharing that, Tabitha. And just by this conversation, and this conversation just brings to light how much people with psychosocial, cognitive, and intellectual disabilities, as well as mental health conditions, might actually be at a very vulnerable position and at a very high risk of inhuman treatment, abuse, coercion, and violence. And as we said, it is very, very wrong, because just as we have seen in the equality rights cause, everyone deserves to be treated with respect and dignity. And so, yes, that is how it has been. That's the culture. But we now need to start changing how we deal with people with the psychosocial disabilities, people with mental health conditions. And remember, we said that those violations of human rights are wrong because we deserve to be treated with respect. And we all have these human rights because we are human. It's not a privilege. It is not a gift that we are given by anyone. By the virtue of being alive and being human, everyone is supposed to have their rights respected in every form. So in very few minutes, I would ask the people who didn't share how they would have rather been treated to share that in a very short time. We can start with Fidelis. How would you advocate for people with mental health conditions and psychosocial disabilities to be treated instead?
Okay, so for me, like in my case, I just wish, first of all, what we need to do is to get the word out there that there are various mental health illnesses that are present, and that people do suffer from mental health illnesses, and it is not a pretense. We are not pretending that we have a mental health problem. I think we need people to believe us, and to believe that whatever that we're going through, it's something that it's not something that you'll have to go through all your life. You can get treated, and we can overcome, as in we can overcome the situation. So how I would like to be treated is, first, people to understand that there are various mental health illnesses. Second, people to believe that, that you have a mental health problem. They don't have to keep, injecting you sedatives or medication so that you can calm down. In fact, even talking can help you calm down. Knowing your triggers, like knowing how to help the person, talking to the person, counseling the person, listening to what the person is actually saying, believing them, helps to resolve, to help to calm the person down and resolve the issues that they're going through. Yes, more amicably, instead of forcefully trying to make somebody calm, or forcefully trying to make somebody sleep so that they just come back to their normal state. Yes.
Okay, thank you so much for sharing that. Welcome back, Masha. We are now just sharing how, as people with the lived experiences, how would we, or how would you want the public to treat people with psychosocial disabilities, people with mental health conditions? We can go to Tabitha first.
I think the society should accept us the way we are. Having a mental health issue is not a curse. It's something we're living with. It's a condition that just like high blood pressure, diabetes. Those people, we don't mistreat them because they have those issues. So they should also embrace us with our mental health illnesses. In fact, they should support us in everything, be it in our workplace, be it in our families, also in our society. They should include us in our society. Even when you're making decisions, they should include us. And once someone needs treatment, they should wasifungue kwa nyumba kama venye Masha alikuwa anasema. They should be waangaliwe, yani in short, they should be taken good care of. And kama ni medication, wapelekwe medication. Kama ni therapy, wapelekwe therapy and all that. So they should, my what I like, which is just to be showed a lot of love and support. Yeah, that's it.
Okay, thank you so much for sharing that with us. Masha, in very few words, how would you like people with mental health conditions, people with psychosocial disabilities to be treated? We can mute.
Thank you so much. For me, number one, the people with psychosocial disabilities should be included in all matters. If it's in medical support, they should be included to be given advice. This is the kind of treatment you're being given, if they are okay with it, or if not, and what best, their wishes of what best should be administered to them. They should be trained also on how to take care of mental. If they are just going to experiences, don't know what they are going through, it will be so bad, and they will keep on thinking that people with mental health issues are violent, they are not coordinative. But in retrospect, it's totally different. We understand, we want also to listen, but at the same time, they should give us time and space to explain ourselves. And above all, I think also for them, they should know their rights. They should know our rights. That way, it will be easier for us to work together.
Thank you so much. Thank you so much for sharing those very important points. Brian, you had mentioned, but do you have anything to add on how would we rather be treated?
Yes, thank you, Immaculate. I think the one thing I would like to clarify is that our right not to be tortured or treated in this degrading and inhumane manner is we use a term absolute, which means that it's never limited or restricted in any way. So watu kama hao wenye wanatutreat hivyo, if may it be in an institution, let's take an institution that we all know very well, I won't even mention it, but such an institution has no excuse until they start using the lack of resources to defend how they are treating their patients. They're not supposed to. It does not apply. If they have it doesn't mean that because you don't have the resources that you treat people in an inhuman and degrading manner. Because even though there are no equipment or facilities or well equipped, it doesn't give any excuse for people to be treated in an inhuman way, because that violates our rights as our dignity as humans, and it's not right. The other thing is what Marsha said. I feel that if we're able to understand our human rights, as well as the CRPD, and also understand what the WHO quality rights stand for, and understand that they are for us and working for us, I feel that we're going to be in a better position to be able to even voice out our grievances, and be able to be able to impact some changes that we need for us to thrive, for our health to thrive. And I don't think there's anything else I can add, apart from yeah, it's only that I only had that in mind. So thank you so much, Ima.
Okay, thank you so much, Brian, for sharing this with us. So among the things that we have mentioned and that we would really want other people in the public to take heed of is, number one is recognizing and responding to when someone is going into distress, or knowing the signs that someone is going into crisis, so that you start being prepared to deal with it. The next thing is providing a supportive environment. As Marsha said, not all people with mental health conditions are violent and uncontrollable, but it's all according to how we approach the situation. If you're showing love and support, you're providing a very calm environment, you'll be able to communicate with this person and it will be much easier. The next thing is good communication skills. Don't have to use lies, coercion, manipulation. Just use very good communication skills. Ensure that the person is understanding. Let them give feedback so that you also get their opinion on what they would like, how they would like to be treated. And next week, we're also going to be talking further on this about informed consent, having a prior treatment plan or an individualized treatment plan, advanced planning, so that just in case a person gets into crisis, even before then, we know how we will deal with the situation. Who do you want to respond to that situation? So all of those things. So remember, everyone has a role to play when it comes to fighting all these violations. And we have said that these violations occur at different places. It can be at home, it can be in the social services, it can be in the health sectors, and we should all have a right to fight against them. And that's why it's very important that we equip ourselves with this information through the quality rights program, so that we ensure that where we see our rights being violated, we speak up. Other people's rights being violated, we also speak up. Because there's a lot that can be done. We don't need to be quiet about all this. So thank you so much to all the champions who are able to join this conversation. As we've mentioned, next time we'll be talking about legal capacity. The ability to participate in your own treatment plan. Being able to say that this option really does have side effects for me, will they have the other option? What we are talking about in advanced planning, coming up with the individualized plan even prior, shifting more to the user-led treatment more than the service provider-led treatment. So that is what we'll be talking about next week, because even people with their mental health conditions and the psychosocial disabilities should participate in their own treatment and should be heard and should be listened to. So thank you so much. Let us continue working together towards promoting a society that ensures human rights of every single person are upheld, regardless of who they are, regardless of whether they have a condition or not. We all need to be treated with respect, with dignity, and fairly and equally. So thank you so much.